High blood pressure, also called hypertension, affects millions of people worldwide and is often called the silent killer because it typically has no symptoms until serious damage occurs. Finding the right blood pressure medication can feel overwhelming with so many options available. In this video, we're going to explore the 10 safest blood pressure medications in 2025, helping you understand what makes each one effective and well tolerated. You might think all blood pressure medications work the same way, but you'd be surprised. Each class of medication works through different mechanisms, and what's safest for one person might not be ideal for another. The medications we'll discuss today have stood the test of time with excellent safety profiles and decades of research supporting their use. However, it's important to understand that while each of these medications is considered safe, they all come with potential side effects. No medication is completely free of side effects, but the ones we're covering today have manageable side effects that most patients tolerate well. So stick around as we uncover the safest options for managing your blood pressure. Let's get started. Before we begin, an important disclaimer. This video is for educational purposes only and should not replace professional medical advice. Never stop taking your blood pressure medication without consulting your doctor, even if you feel fine. High blood pressure typically has no symptoms, but it's still damaging your organs silently. Always work with your healthcare provider to determine what's best for your individual situation. 10. Clonidine, central agonist. Clonidine represents a blood pressure medication class called central agonists, meaning they work directly in your brain to lower blood pressure. The exact mechanism of how clonidine works in the brain isn't completely understood, but researchers know it affects certain receptors in the central nervous system that regulate blood vessel tone and heart rate. By acting on these brain receptors, clonidine reduces nerve signals that cause blood vessels to constrict. The important thing to understand about clonidine is that it should never be your first medication for high blood pressure. This drug carries a significant side effect burden and has more risks than newer, safer alternatives. Clonidine is typically reserved for very specific situations where other medications have failed or when there are particular medical reasons requiring its use. One of the most concerning aspects of clonidine is what happens if you suddenly stop taking it. Abruptly discontinuing clonidine can cause a dangerous rebound effect where your blood pressure spikes dramatically, sometimes to levels even higher than before treatment. This rebound hypertension can occur within 18 to 48 hours of stopping the medication and can lead to serious complications, including stroke or heart attack. Common side effects of clonidine include severe drowsiness and fatigue that can interfere with daily activities and make driving dangerous. Many patients experience significant dry mouth that persists throughout treatment. Dizziness, particularly when standing up, occurs frequently and can lead to falls, especially in older adults. Constipation is common and can be bothersome. Some patients develop depression or experience vivid, disturbing dreams. If you're currently taking clonidine as your only blood pressure medication and you don't have other complex medical conditions, this is a situation that warrants an immediate conversation with your healthcare provider. Ask them why you're on clonidine instead of one of the much safer alternatives like ARBs or ACE inhibitors. There may be a valid reason, but if not, discussing a medication change could significantly improve your quality of life while still effectively controlling your blood pressure. 9. Terazosin and doxazosin, alpha blockers. Terazosin and doxazosin belong to a medication class called alpha blockers. These drugs work by blocking alpha receptors found in the smooth muscle of blood vessel walls. When these receptors are blocked, the muscles relax, causing blood vessels to dilate and blood pressure to decrease. While this mechanism effectively lowers blood pressure, alpha blockers come with a concerning side effect profile that makes them poor choices for first-line blood pressure treatment. The most significant concern with alpha blockers is orthostatic hypotension, a sudden drop in blood pressure that occurs when you stand up from sitting or lying down. This can cause severe dizziness, lightheadedness, and fainting spells that pose serious fall risks, particularly for older adults. The first dose effect is particularly pronounced, meaning the first time you take an alpha blocker, you may experience a dramatic blood pressure drop that can cause you to lose consciousness. Alpha blockers are sometimes prescribed for men with enlarged prostate because they help relax the muscles in the prostate and bladder neck, improving urinary flow. If you're taking terazosin or doxazosin for both blood pressure and prostate symptoms, that's a legitimate dual purpose. However, if you're taking these medications solely for blood pressure control without any prostate issues, that's a red flag situation. Other common side effects include persistent fatigue and lack of energy that many patients find debilitating. Headaches occur frequently, especially when first starting treatment. Nasal congestion is common and can be bothersome. Some men experience sexual side effects, including difficulty with erections. Palpitations or awareness of your heartbeat can occur as your body tries to compensate for the blood pressure drop. Alpha blockers also carry a small but concerning risk of a condition during cataract surgery called intraoperative floppy iris syndrome, which can complicate the surgical procedure. If you're scheduled for cataract surgery and you're taking an alpha blocker, your eye surgeon needs to know this in advance. If terazosin or doxazosin is your first and only blood pressure medication, schedule an appointment with your healthcare provider to discuss why you're on an alpha blocker rather than a safer alternative. Unless there's a specific reason like prostate enlargement, these medications generally should not be first-line therapy for uncomplicated high blood pressure. 8. Furosemide and bumetanide, loop diuretics. Furosemide and bumetanide are powerful diuretics known as loop diuretics because they work on a specific part of your kidney called the loop of Henle. These medications cause your kidneys to excrete large amounts of fluid and salt, which reduces blood volume and subsequently lowers blood pressure. While very effective at eliminating fluid, loop diuretics are far too potent for treating simple high blood pressure in most patients. Loop diuretics cause profound diuresis, meaning you'll urinate much more frequently and in larger volumes than normal. This powerful fluid-removing effect can quickly lead to dehydration if you're not careful. The medications work rapidly, often within 30 minutes to an hour of taking them, and the diuretic effect can last for 6 to 8 hours, disrupting your daily activities with frequent bathroom trips. The most concerning issue with loop diuretics is their tendency to severely disrupt your body's electrolyte balance. These medications cause you to lose significant amounts of potassium, magnesium, calcium, and sodium through increased urination. Low potassium levels can cause dangerous heart rhythm disturbances, muscle weakness, and cramping. Low magnesium can trigger irregular heartbeats and worsen muscle problems. The electrolyte imbalances require frequent blood test monitoring and often necessitate taking multiple supplements. Loop diuretics are absolutely necessary and life-saving for patients with heart failure, severe kidney disease, or significant fluid overload. If you have one of these conditions, furosemide or bumetanide may be exactly what you need. However, for someone with simple high blood pressure and no other medical problems, loop diuretics are overkill and carry unnecessary risks. Common side effects beyond electrolyte problems include dizziness and lightheadedness from the blood pressure lowering effect. Some patients experience ringing in the ears or temporary hearing changes, particularly at higher doses. Blood sugar levels can rise, potentially worsening diabetes or pushing you toward prediabetes. Uric acid levels increase, which can trigger gout attacks in susceptible individuals. Frequent urination disrupts sleep if you need to take the medication later in the day. If you're taking furosemide or bumetanide solely for high blood pressure and you don't have heart failure, severe kidney disease, or significant swelling, you need to have a conversation with your healthcare provider about why you're on such a powerful diuretic instead of gentler, safer alternatives. 7. Atenolol, metoprolol, and nebivolol, beta blockers. Atenolol, metoprolol, and nebivolol belong to the beta blocker class of medications. These drugs work by blocking beta receptors in your heart and blood vessels. When these receptors are blocked, your heart beats more slowly and with less force, and blood vessels relax slightly. While beta blockers effectively lower blood pressure, they come with side effects that make them less than ideal as first-line therapy for uncomplicated hypertension. One of the most concerning effects of beta blockers is their potential to lower testosterone levels in men. Multiple studies have shown that beta blockers can suppress testosterone production, leading to decreased energy, reduced muscle mass, lower libido, and potential erectile dysfunction. For men concerned about maintaining healthy testosterone levels, beta blockers should generally be avoided unless absolutely necessary. Beta blockers are also notorious for raising blood sugar levels and worsening insulin resistance. These medications can interfere with your body's ability to regulate blood glucose, potentially pushing you from prediabetes into diabetes or making existing diabetes harder to control. The mechanism involves blocking receptors that normally help your body release glucose when blood sugar drops, making it harder to recover from low blood sugar episodes. That said, beta blockers are absolutely the right choice for specific medical situations. If you've had a heart attack, beta blockers significantly improve survival and reduce the risk of another heart attack. For patients with heart failure, certain beta blockers strengthen the heart over time and extend life expectancy. If you have certain heart rhythm problems like atrial fibrillation, beta blockers help control heart rate. For severe migraines, beta blockers can reduce frequency and severity. If a cardiologist or specialist prescribed you a beta blocker, there's likely a very good reason beyond simple blood pressure control. However, if you're taking a beta blocker as your first and only medication for high blood pressure and you don't have any heart problems, that's worth discussing with your provider. Common side effects include significant fatigue and reduced energy that many patients find frustrating. You may feel like you can't exercise as intensely as before. Cold hands and feet occur because beta blockers reduce blood flow to extremities. Some people experience vivid dreams or nightmares. Sexual side effects are common in both men and women. Dizziness when standing can occur. Some patients develop symptoms of depression. Shortness of breath may occur, particularly in people with asthma or lung disease. Nebivolol is a newer beta blocker that may have fewer side effects than older drugs like atenolol or metoprolol, but it still carries the beta blocker class effects on testosterone and blood sugar. If you're concerned about these effects, discussing ARBs or ACE inhibitors with your doctor would be worthwhile. 6. Amlodipine, diltiazem, verapamil, and nifedipine, calcium channel blockers. Amlodipine, diltiazem, verapamil, and nifedipine are calcium channel blockers that work by preventing calcium from entering muscle cells in your heart and blood vessels. Without calcium, these muscles cannot contract as strongly, resulting in blood vessel relaxation and lower blood pressure. These medications are more effective at lowering blood pressure than beta blockers and have a better side effect profile, but they're still not ideal as first-line therapy for most patients. Calcium channel blockers are divided into two main types. Dihydropyridines like amlodipine and nifedipine primarily affect blood vessels. Non-dihydropyridines like diltiazem and verapamil affect both blood vessels and the heart, slowing heart rate. Each type has its own specific side effect profile. The most common and bothersome side effect of dihydropyridine calcium channel blockers, like amlodipine, is peripheral edema, swelling in the ankles and feet. This affects about 10 to 20% of patients and occurs because the medication dilates small blood vessels in the legs, allowing fluid to leak into surrounding tissues. The swelling is usually symmetrical, affecting both legs equally, and tends to worsen as the day progresses. While not dangerous, it can be uncomfortable and cosmetically concerning. Headaches are common when first starting calcium channel blockers, though they usually improve within a few weeks. Some patients experience facial flushing or a warm red feeling in their face and neck due to increased blood flow to the skin. Palpitations or awareness of your heartbeat can occur, particularly with dihydropyridines. Dizziness may develop, especially when standing up quickly. Diltiazem and verapamil, the non-dihydropyridine calcium channel blockers, have additional side effects related to their heart-slowing effects. These include fatigue similar to beta blockers, constipation, which can be quite severe with verapamil, and potential heart rhythm disturbances if you're taking other medications that slow the heart. Calcium channel blockers can interact with grapefruit juice, which significantly increases drug levels in your blood and raises the risk of side effects. If you're taking a calcium channel blocker, you should avoid grapefruit and grapefruit juice entirely. If you're currently taking a calcium channel blocker as your first and only blood pressure medication and you don't have any other medical conditions, it's worth asking your healthcare provider why you're on this class instead of an ARB or ACE inhibitor. Calcium channel blockers work well as second-line therapy or for specific conditions, but they're not the safest first choice for uncomplicated hypertension. 5. Hydrochlorothiazide and chlorthalidone, thiazide diuretics. Hydrochlorothiazide and chlorthalidone are thiazide diuretics, sometimes called water pills. These medications work by helping your kidneys eliminate extra salt and water from your body. As blood volume decreases, pressure in your arteries drops. Thiazide diuretics are much gentler than loop diuretics and have been used for decades with generally good results, making them acceptable second-line therapy for blood pressure control. The key advantage of thiazide diuretics is that they're inexpensive, well-studied, and moderately effective. They've been around since the 1950s, so doctors have extensive experience with them. Many combination pills pair a thiazide diuretic with an ARB or ACE inhibitor, and these combinations work synergistically to control blood pressure better than either drug alone. However, thiazide diuretics do have some concerning metabolic effects that make them less than ideal as sole therapy. These medications can raise blood sugar levels by interfering with insulin secretion and increasing insulin resistance. For patients with prediabetes, thiazides may push them into frank diabetes. For those already diabetic, blood sugar control may worsen, requiring medication adjustments. Thiazide diuretics also disrupt electrolyte balance, though not as severely as loop diuretics. They cause your body to lose potassium through increased urination, which can lead to low potassium levels called hypokalemia. Low potassium can cause muscle weakness, cramping, and potentially dangerous heart rhythm disturbances. Many patients need to take potassium supplements or eat potassium-rich foods like bananas, potatoes, and avocados to maintain normal levels. These medications can raise uric acid levels, potentially triggering gout attacks in susceptible individuals. Gout is a painful form of arthritis caused by uric acid crystal deposits in joints, typically affecting the big toe. If you have a history of gout, thiazide diuretics should be used cautiously. Common side effects include increased urination, particularly during the first few weeks of treatment. This usually improves as your body adjusts, but it can be disruptive initially. Dizziness or lightheadedness may occur, especially when standing up quickly due to reduced blood volume. Some patients experience increased sensitivity to sunlight, making sunburn more likely. Men may experience mild erectile dysfunction at higher doses. Thiazide diuretics should be considered second-line therapy, meaning they're typically added to an ARB or ACE inhibitor if blood pressure isn't adequately controlled with one medication. If you're taking hydrochlorothiazide or chlorthalidone as your only blood pressure medication, it's worth discussing with your provider whether starting with an ARB or ACE inhibitor might be better, with the diuretic added later if needed. 4. Benazepril, ACE inhibitor. Benazepril is an ACE inhibitor, a medication class that represents the second safest option for blood pressure treatment. ACE stands for angiotensin converting enzyme, and these drugs work by blocking the enzyme that produces angiotensin II, a powerful substance that narrows blood vessels. By preventing angiotensin II production, benazepril allows blood vessels to relax and widen, reducing the resistance against which your heart must pump. All ACE inhibitors end in the suffix pril, making them easy to identify. Benazepril has been used for decades with an excellent safety record. It's available as an inexpensive generic and provides reliable blood pressure control with once or twice daily dosing. The medication begins working within 1 hour of taking it, though full blood pressure lowering effects develop over several weeks. Beyond lowering blood pressure, benazepril provides important organ protection. The medication reduces strain on your kidneys and slows the progression of kidney disease, particularly in patients with diabetes. For heart attack survivors, ACE inhibitors improve survival and reduce the risk of future cardiac events. The medication also benefits patients with heart failure by improving symptoms and extending life expectancy. ACE inhibitors are pretty safe for most people, with minimal effects on blood sugar, testosterone levels, or electrolytes compared to many other blood pressure medications. There are numerous generic varieties available, making them affordable for virtually everyone. If your doctor prescribed an ACE inhibitor like benazepril as your first blood pressure medication, that's a sign you have a knowledgeable healthcare provider who stays current with medical research. However, ACE inhibitors aren't quite as side effect free as the safest class we'll discuss next. The most notorious side effect of ACE inhibitors is a persistent dry cough that affects about 10 to 20% of patients. This cough develops because ACE inhibitors increase levels of a substance called bradykinin in the lungs, which irritates the airways. The cough is typically dry, persistent, and worse at night. It doesn't respond to cough suppressants and doesn't improve over time. The cough itself is harmless and doesn't indicate lung damage, but it can be incredibly annoying and disruptive to sleep. Some patients can tolerate it, but others find it so bothersome they need to switch medications. If you develop this cough while taking benazepril or any ACE inhibitor, switching to an ARB eliminates the problem while maintaining excellent blood pressure control. Other potential side effects include dizziness when standing up quickly, particularly during the first few days of treatment. Some patients experience mild fatigue. ACE inhibitors can raise potassium levels slightly, so your doctor will monitor this with periodic blood tests. In very rare cases, ACE inhibitors can cause angioedema, a serious swelling of the face, lips, tongue, or throat that requires immediate emergency treatment and permanent discontinuation of the medication. 3. Lisinopril, ACE inhibitor. Lisinopril is the most commonly prescribed ACE inhibitor and shares the same excellent safety profile as benazepril. It works through the identical mechanism, blocking the enzyme that produces angiotensin 2. Lisinopril has been studied more extensively than perhaps any other blood pressure medication, with millions of patient years of safety data supporting its use. The popularity of lisinopril stems from several factors. It's extremely affordable, often costing just pennies per pill even without insurance. It's taken once daily, making it convenient and easy to remember. It provides consistent 24-hour blood pressure control. It has decades of research proving its effectiveness for blood pressure reduction, kidney protection, and cardiovascular benefits. Lisinopril offers the same organ protective benefits as other ACE inhibitors. It reduces protein loss in the urine and slows kidney disease progression, particularly important for diabetic patients. It improves survival after heart attacks and reduces the risk of heart failure. These additional benefits make ACE inhibitors more than just blood pressure medications. They're comprehensive cardiovascular protective agents. The side effect profile of lisinopril is virtually identical to benazepril. That persistent dry cough remains the main complaint, affecting roughly 10 to 20% of patients. If you're one of the lucky majority who doesn't develop the cough, lisinopril is an excellent, affordable blood pressure medication. If the cough does develop, switching to an ARB solves the problem. Other potential side effects include dizziness, mild fatigue, elevated potassium requiring monitoring, and very rarely angioedema. The overall side effect burden is low compared to most other blood pressure medication classes. If you're taking lisinopril as your first blood pressure medication and you're not experiencing the cough, you're in good shape. Your doctor made a solid, evidence-based choice. However, if that dry cough is bothering you, don't suffer through it. Talk to your doctor about switching to an ARB, which provides similar benefits without the cough. 2. Quinapril, ACE inhibitor. Quinapril rounds out our discussion of ACE inhibitors as the second safest medication class for blood pressure treatment. Like benazepril and lisinopril, quinapril blocks angiotensin-converting enzyme, preventing the production of angiotensin 2 and allowing blood vessels to remain relaxed. The medication has an excellent safety record spanning several decades of clinical use. Quinapril may be prescribed less frequently than lisinopril simply because lisinopril has become the default ACE inhibitor for many healthcare providers. However, quinapril is equally safe and effective. It's available as a generic, though it may cost slightly more than lisinopril in some pharmacies. The medication is taken once or twice daily and provides reliable blood pressure reduction. Like other ACE inhibitors, quinapril offers cardiovascular and kidney protection beyond blood pressure lowering. It reduces the progression of kidney disease, improves outcomes after heart attacks, and benefits patients with heart failure. These organ protective effects make ACE inhibitors valuable tools in preventing long-term complications of hypertension. The side effect profile of quinapril mirrors that of other ACE inhibitors. The persistent dry cough affects approximately 10 to 20% of patients and remains the most common reason for switching to a different medication. Dizziness, mild fatigue, and elevated potassium can occur but are generally manageable with monitoring. If your healthcare provider prescribed quinapril as your first blood pressure medication, they made a good, safe choice based on current medical evidence. ACE inhibitors represent excellent therapy that's just one small step behind the safest medication class in terms of side effects. 1. Losartan, valsartan, and candesartan, ARBs, angiotensin receptor blockers. ARBs, or angiotensin receptor blockers, represent the safest blood pressure medication class with the lowest side effect profile. All drugs in this class end in the suffix sartan, making them easy to identify. The three most commonly prescribed ARBs are losartan, valsartan, and candesartan, though several others exist. These medications work by blocking the receptors where angiotensin 2 would normally attach, preventing blood vessel constriction and lowering blood pressure. Study after study has demonstrated that ARBs have fewer side effects than any other blood pressure medication class. A landmark study directly comparing ARBs to ACE inhibitors found that ARBs cause slightly fewer side effects overall and significantly fewer discontinuations due to side effects. When compared to beta blockers, calcium channel blockers, or diuretics, the difference is even more dramatic. ARBs simply cause fewer problems for patients. The beauty of ARBs is what they don't do. They don't cause the persistent dry cough that plagues ACE inhibitor users. They don't lower testosterone like beta blockers. They don't raise blood sugar like thiazide diuretics and beta blockers. They don't cause ankle swelling like calcium channel blockers. They don't disrupt electrolytes significantly like diuretics. Most patients taking ARBs experience no side effects whatsoever. ARBs provide excellent organ protection similar to ACE inhibitors. They reduce kidney disease progression, particularly in diabetic patients with protein in their urine. They lower stroke risk more effectively than some other blood pressure medication classes. They improve outcomes in heart failure patients and after heart attacks. These cardiovascular benefits make ARBs comprehensive protective agents, not just blood pressure pills. Generic versions of Losartan are widely available and quite affordable. Valsartan and candesartan also have generics, though they may cost slightly more than Losartan in some areas. Even the name brand versions are reasonably priced compared to many medications. Most insurance plans cover ARBs with low copays. ARBs are taken once daily, providing consistent 24-hour blood pressure control. They begin working within a few hours of the first dose, though maximum effects develop over several weeks of consistent use. The once-daily dosing schedule makes them convenient and improves medication adherence, which is crucial for long-term blood pressure control. The few side effects that can occur with ARBs are generally mild and uncommon. Some patients experience slight dizziness during the first few days of treatment as their body adjusts to lower blood pressure. This typically resolves quickly. ARBs can raise potassium levels slightly, so your doctor will monitor this with periodic blood tests, though the elevation is usually minimal. Very rarely, ARBs can cause angioedema similar to ACE inhibitors, but this occurs less frequently than with ACE inhibitors. If your healthcare provider prescribed an ARB like Losartan, Valsartan, or candesartan as your first blood pressure medication, congratulations. You have a knowledgeable doctor who stays current with medical research and prioritizes choosing the safest, most effective medication for you. ARBs represent the gold standard for first-line blood pressure treatment in patients without other medical complications. Understanding your blood pressure medication options empowers you to have informed discussions with your healthcare provider about what's best for your individual situation. The medications we've discussed today range from those that should rarely be used as first-line therapy due to significant side effects, to ARBs, which represent the safest option with minimal side effects. If you're worried about your testosterone levels, definitely avoid beta blockers. If you're concerned about blood sugar, avoid thiazide diuretics and beta blockers. If you're taking one of the medications we discussed early in this video, clonidine, alpha blockers, or loop diuretics, and you don't have a specific medical reason requiring those drugs, it's time to have a conversation with your healthcare provider about switching to a safer alternative. Blood pressure control is a journey, not a destination. It may take time to find the right medication or combination that works best for you. Never stop taking your blood pressure medication without consulting your doctor, even if you feel fine. High blood pressure typically has no symptoms, but it's still damaging your organs silently. Let me know in the comments which one of these medications you want me to deep dive into. I'd love to create a detailed video on the medication you're most interested in learning about. Found this useful? Give it a like, share it with others, and subscribe for more practical health information. Take care of your heart, and we'll see you in the next video.